Wrong statement about prasugrel. A. Not influenced by CYP inhibitors. B. Higher bleeding risk in those with previous cerebrovascular events. C. Use in acute coronary syndrome is better restricted to the cath lab. D. Recommended in those above 75 years. Correct answer D. Recommended in those above 75 years. Prasugrel has a higher bleeding risk in those above 75 years and in those with body weight less than 60 kg. Prasugrel is not interfered with by CYP inhibitors, CYP2C19 gene variants, or proton pump inhibitors, unlike clopidogrel. Rapid onset of action enables its use in the cath lab after coronary angiography if percutaneous coronary intervention is the option. This avoids the bleeding risk after an initial loading dose, which could be significant in case the option after angio is for early coronary artery bypass grafting. Prasugrel is better in diabetic patients and in moderate to high risk non-ST elevation acute coronary syndromes. Which of the following is a marker of myocardial stretch? A. BNP, B. Troponin, C. Myoglobin, D. Galactin 3. Correct answer A. BNP. BNP and NT-proBNP are markers of myocardial stretch which can be markedly increased in heart failure. They can also be used to differentiate between constrictive pericarditis and restrictive cardiomyopathy, as there is no myocardial stretch in constrictive pericarditis. Troponin is a marker of myocardial necrosis, and so is myoglobin, though the former is highly specific while the latter is non-specific. Galactin 3 is a new biomarker protein, a member of the lectin family. It is associated with activation of macrophages and fibroblasts. This results in secretion of procollagen 1, which is cross-linked to form collagen. Hence, galactin 3 can be considered as a marker of cardiac fibrosis. Reversed mismatch on positron emission tomography scan is seen in A. Left bundle branch block, B. Right ventricular pacing, C. Non-ischemic cardiomyopathy, D. All of the above. Correct answer 4. All of the above. Reversed mismatch means normal perfusion with reduced uptake of 18-fluorodeoxyglucose. In addition to the above conditions, this situation can also be seen in the setting of revascularization early after myocardial infarction and sometimes in diabetes mellitus. Usual perfusion metabolism mismatch is reduced myocardial perfusion and contractile function with relatively preserved or increased FDG uptake. It may be noted that ischemic myocardium switches over to glucose utilization instead of the usual fatty acid metabolism, as glucose metabolism gives more ATP per oxygen molecule used. Tracers used to assess perfusion during PET scan include rubidium-82 and N13 ammonia. Tracer used to assess cardiac sympathetic denervation: A. 11C metahydroxyephedrine, B. technetium 99M sestamib, C. fluorodeoxyglucose, D. None of the above. Correct answer C. 11C metahydroxyephedrine. Myocardial sympathetic denervation assessed by 11C metahydroxyephedrine has been shown to be predictive of sudden cardiac death. AV block in the presence of features of dilated cardiomyopathy may indicate A. sarcoidosis, B. Lyme disease, C. myotonic dystrophy, D. All of the above. Correct answer D. All of the above. Other conditions associated with this combination are laminace mutation and giant cell myocarditis. Pick the wrong statement. A. Light chain cardiac amyloidosis has a better survival than transthyretin cardiac amyloidosis. B. Light chain cardiac amyloidosis responds to chemotherapy. C. Transthyretin cardiac amyloidosis is associated with sensory motor polyneuropathy. D. Transthyretin cardiac amyloidosis can be detected by bone scintigraphy. Correct answer A. Light chain cardiac amyloidosis has a better survival than transthyretin cardiac amyloidosis. Light chain cardiac amyloidosis with left ventricular systolic failure has a median survival of 4 months, while transthyretin amyloidosis has a median survival of 3 to 6 years. Patients with less than 20% light chain amyloidosis load who respond to chemotherapy has been shown to have a better survival than those who do not respond. Light chain amyloidosis involves almost all organs, with predominant involvement being in the heart and kidneys. Transthyretin, the precursor protein in senile systemic amyloidosis and familial TTR-related amyloidosis, is a tetrameric plasma transport protein synthesized in the liver. TTR-derived fibrils show avidity for bone tracers, especially 99M technetium DPD. Prevalence of hypertrophic cardiomyopathy in humans: A. 1 in 50, B. 1 in 500, C. 1 in 1000, D. 1 in 1500. Correct answer B. 1 in 500. Hypertrophic cardiomyopathy is an autosomal dominant disorder with prevalence of 1 in 500 in human beings. Recommended test for monitoring the effect of bivalirudin during cardiopulmonary bypass: A. Activated clotting time, B. Acarine clotting time, C. Prothrombin time, D. Activated partial thromboplastin time. Correct answer B. Acarine clotting time. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.